Ride's been so exciting. It's so great to raise awareness about this, especially in London, where I guess the air pollution is so damaging to so many people, especially those who contribute the least. So the people walking on the streets by the cars are the ones who are most vulnerable, so children, women, people of colour, and they're not actually emitting. And as health professionals, these are our patients. So I'm still a medical student, so future patients. And I think we have to be vocal in our concern about the situation. We're a trusted voice, so we can play a part in kind of raising awareness about this. I know we don't have very long, but I'll share like a small story of a very kind of significant moment for me in medical school, where we were working on a project on 3D printing, and we were 3D printing ribs for lung cancer patients. And I remember being in the theatre with the cardiothoracic surgeon, and this gentleman had like completely black lungs. And I just asked very casually, as medical students do, how many did he smoke a day? Because we're used to 30, 40 cigarettes leading to lung cancer. And he's like, he was a never smoker. He just lived by a busy street in London. I think that was one of my light bulb moments, because I was in my second year. I don't think we'd heard about the health impacts of the climate crisis, which is on the radar, is on your radar from the news. But to see those lungs in front of you and know that like that's how people are walking around in London is very eye-opening and very scary, to say the least. I think it's Students for Global Health. So I'm actually part of the Climate and Health National Working Group. But we aim to educate, advocate, and take action. I think it's very clear that the climate crisis is a health crisis, and therefore we need to get political. And it's very hard getting medical professionals to get political. But a net zero NHS cannot exist in a silo. Like, if you can reduce your carbon emissions, but carbon footprinting, first of all, a marketing scheme by BP, and it's worked very well, because now everyone is very passionate about their carbon footprint. However, we're a little bit more focused on 3 campaigns this year. So we're focusing on no new oil and gas. The evidence is very clear. Like, we don't have room for any more fossil fuel infrastructure, but our government continues to approve new projects. So we're working very closely with kind of Stop Cambo, Stop Jackdaws, Stop Rosebank, it goes on and on. Even outside the UK, we're partnering with Stop ECOP, which is going to be a huge pipeline across East Africa. And then our other kind of focus group is the Loss and Damage Youth Coalition. So the conferences of the parties talk about mitigation and adaptation. What about the people who are trying to survive after the loss and livelihood, the loss of lives and livelihood after, they say, natural disasters, fossil fuel-induced disasters. So our focus is kind of collaborating with them, putting their kind of frontline voices, like amplifying their voices. And then the other thing we're focusing on is kind of climate displacement and the impact on health. Something like, I forgot the exact statistic, but a lot of people are going to be displaced over the next 20, 30 years.
I think it's 1 billion, a conservative estimate, 1 billion climate refugees by 2050, is that the figure?
So it's very scary. So we are strong advocates for the Green New Deal, and I know we don't have very long, so I won't go into too much, but the public health for a Green New Deal, public health case for a Green New Deal centres around kind of 6 demands. So that's quality housing, so kind of insulation, damp, etc. Land and food justice, so improving our agricultural practices, healthy air, of course, tackling kind of traffic problems, reinventing the transport systems, of course decarbonising the energy system, so this kind of moving towards renewables. And then very importantly, green jobs for all. And this isn't just working on wind farms, this is creating more nursing jobs, improving social prescribing, because they're what makes a healthcare system sustainable. If you can keep people out of hospital, you can reduce the number of surgeries that have to happen. If you're keeping people well in the community, if you're creating systems where people can access what they need closer to home, then that's how you can kind of move towards a just transition away from the current system, which is very exploitative and extractive, and it's true, people are getting left behind. I think at Students for Global Health, we very much see the climate issue as an issue of justice, and it intersects with all the other injustices in lots of ways, because at the end of the day, the same root causes of any form of injustice comes back to the current system. But I finish on a little optimistic quote that I like. Hope is our most powerful tool against the status quo. And it's true, because although guilt can drive people into certain things, hope appears to be more effective according to the evidence. And it's a lot easier to do things if you feel hopeful. You can take action and not sit in despair, as people on their personal journeys and to the environment can often do. And at Students for Global Health, we work very closely with MedAct, which is like a grassroots organisation on the Health for a Green New Deal. And I think we really believe that the NHS is an anchor institution, so you do have a role of influence. And as we said, doctors, physiotherapists, the health professionals in general are trusted individuals. Therefore, we have the privilege of being able to influence people, maybe. And I think in the health community at the moment, or around sustainability in healthcare, people are talking about patient choice and allowing patients to pick medications based on tiny carbon footprints. And I think that's a bit of a distraction. I think instead we should have the opportunity to encourage people to maybe vote with the climate in mind. So that's what they did in Australia. They, their health alliance, I've forgotten their name,
is it the GCH?
Exactly. So they decided to get political and campaign on kind of voting with the kind of politicians' commitment to the environment. So obviously as doctors you can't get too political in your everyday role, but you can kind of join campaigns that do. So at MedAct, like the Health for a Green New Deal team get involved with all sorts of things, but we're also kind of branching out. So for example, I think someone mentioned their organisation has divested, and actually a lot of the Royal Colleges have divested, well, committed to divest. Let's see how commitment turns into action. But again, you can kind of create that influence within the system and also put that pressure outside, because we talk a little bit about power balances, and actually the power can be with the people. Like in an economic system, if you have enough pressure, you can get politicians to do things that keep them popular. So I guess building that traction.